G.W. Smith is here, and you guys know each other from Surfing World, right?
Absolutely.
Yeah, and he's up. He's probably seen my kids. I don't know. He's up at a couple blocks away anyway.
Yeah, not far.
Okay.
So I'm right on 10th Street.
Right on 10th Street.
Absolutely.
At the
AGH Townsend Medical Center.
There you go. All right. Now, and you're officially a
physician assistant.
Physician's assistant. Okay.
Absolutely.
All right. And last time we were in here, we were talking about that. And this time we're talking about high blood pressure, hypertension, white coat syndrome, all that stuff. You just got nervous.
No, I'm kidding.
All right.
I don't get
So what are we talking?
So when we talk about blood pressure, it's probably one of the most commonly diagnosed chronic comorbidities. So something that a lot of people in the population have. A common misnomer is, just like Lee's sitting here claiming, you end up at the doctor's office, you get your vitals taken, the nurse checks it, and all of a sudden you have high blood pressure. The criteria for diagnosing it would be more than one time. So if you come in the first time, meet me, Bulldog, and you're like, oh, God, I'm nervous as crud, I don't really want to meet this guy, anything else, and your blood pressure's up, that's fine, it's all forgiven. We send you home, we have you take a journal and a blood pressure, make sure everything's cool at home, you come back, everything looks normal. We look at it as white coat syndrome. Nerves, anxiety, it can contribute to having high blood pressure. Your kid comes up and kicks you in the shin, your blood pressure's going to go up. It's reactionary, right?
Okay.
But if you continually have high blood pressure at home, high blood pressure when you see a doctor, then we diagnose you with hypertension.
Okay.
So you get rid of the kid at that point?
Exactly. I mean, that's the easiest solution is to get rid of the kid, get rid of the stress causer.
Why don't you guys wear different color coats? That way may help.
Well, see, that's why I don't wear a white coat.
Oh, okay.
Can you explain the numbers? Because, you hear them. And
120 over 80.
Yeah,
That's
you
good,
hear all the
right?
numbers. Like, what's a comfortable number you're with, or where are you starting to get concerned?
So if they're both 0, that's bad.
Yes.
Well, you're dead.
All right. Yeah. So 120 over 80 is the standard. Okay, you're doing all right. You're within the lines. But there's a lot of patients that hover, situationally. They've come in. They've already had a cup of coffee. They've had their breakfast. They're flying around. 130s over 90s, things like that are still okay. As you start to edge up past the 130s, which is the top number of the systolic, and the diastolic is the bottom number at 90, you start getting into hypertension. The American Heart Association or the American Association.
Well, I just want to say, so let's go what's the
systolic?
Okay,
systolic is the one on top.
What does that mean? What is that 130 what? Like, what's 130 beats, 130 watts?
It's millimeters of mercury. So
I never knew that. I didn't.
So the liquid thing you used to see go up and down in the cuff when they put it on you, that actually used to be out of mercury. So they
talking about the cuff. When you guys put the cuff on, and then you pump me up, and then you're listening. What are you listening for? What are you? I thought you're counting to 130 or 120. No. What is that?
So as we continue to pump the blood pressure cuff up, eventually the constriction of the actual blood pressure cuff will cause us to stop hearing a pulse. Right?
Oh, okay.
So once we stop hearing a pulse, we start to dial it back to start listening when the pulse returns, and that gives you your bottom number. So you're answering your own question. The top number would be where the pulse goes away. The bottom number is where it returns. So it'll go basically silent, and then as you come down, your blood pressure starts pounding back from restricting that vessel.
And you're looking at the mercury.
Well, now it's all that's a pressure gauge, but yeah, it used to be mercury.
Got it. Okay, I never knew what it was.
I had no idea. My mind's blown.
I didn't know that.
That's so cool to learn.
Yeah. That's what you do around this place. You learn stuff when you tune in.
Yeah.
The thing we're looking for, the biggest problem with high blood pressure would be things like hypertensive urgency and emergency. When those get bad, and I think the point of kind of getting the information out to the public is if you're like, man, I think I have high blood pressure, and you start feeling pulsations behind your eyes or severe headache, shortness of breath, that kind of stuff, that's when it's time to be like, all right, time to go to the hospital.
So, but there's also that it's known as the silent killer, or something like that, where you don't know, and it just you don't have symptoms, right?
Right, and so if it gradually goes up over the years, you're a guy, you've got kids, you're a lady, you get kids, you gain a little weight, you eat a little not bad, you celebrate on weekends, you do things, and your blood pressure goes up 10 here, 10 there, 10 here, 10 there.
Now you're
all of a sudden,
now you're 160.
Right, and now you're at 160, but you don't feel it because it's been happening for 5 years, right?
Okay.
All of a sudden, you have the worst day you've ever had. Something happens. Blood pressure hits 180, 200, and all of a sudden you got this pounding headache. Your eyes are hurting, and you're like, man, this is just the worst headache I've ever had. When in reality, what's happening is the blood vessels that are being delivered blood by your heart and everything else, the pressure is so high that you're actually causing damage.
Okay.
So it's kind of like blowing a tire up past its capacity. Eventually, it's going to give out.
So, like, would you see somebody in there and you pump them up and you got, I don't know, 180 over 110 or I don't know. I mean, high numbers like that, and they're fine.
So, I mean, it's all clinical, right? So, say Lee comes in and his blood pressure is 180 over 110, and I go, how do you?
He'd be thrilled with it. No,
I go, how do you feel?
I have good blood pressure.
How do you feel? And he goes, yeah, I'm fine. I go, okay, well, you shouldn't feel fine. This isn't normal. We need to get you back in 2 weeks and start you on medicine. But another thing is, and I think this is a big problem in primary care, is if you're 180 over 110 and I give you enough medication to get you down to 100 over 80 or 100 over 75, you're going to feel horrible. You're going to feel like I took you from driving 100 miles an hour to 50, and your body's going to be like, whoa, I'm very fatigued.
But you're telling me those numbers are good.
They are good, but you have to, just like you've gradually gone up over the years, you kind of have to taper it down. I mean, you don't do it over years. You want to get down quickly.
What the medicine you give, the high blood pressure medicine? You always hear about that. What?
We have here. Ooh, so that's a beta blocker. So that
But it works.
It does, but it doesn't work as well as bringing down blood pressure as it does contractility of the actual heart.
Oh.
So it's a different kind of med.
Maybe I'm treated for something else I don't know.
No. No, we use that a lot. We use metoprolol a lot. But as far as first-line medications for bringing down blood pressure in newer literature, you would look at amlodipine, which is a calcium channel blocker. You'd look at lisinopril or losartan, maybe hydrochlorothiazide, which is a diuretic. There's many different...
And what do they do, actually?
So, all right, well, the easiest one to explain is probably a diuretic. So, a hydrochlorothiazide or a lisinopril, or a Lasix or something like that, it works off of the way your kidneys function to get rid of volume. So, if you decrease volume in a pumping circuit, you decrease pressure, right?
Okay.
So, old school medicines like hydrochlorothiazide, you got to tell all your patients, you're going to pee a lot. Because the higher your pressure is, the more you're going to urinate. There's a system of communication through chemicals with your kidneys and your heart that let each other know how they're doing.
Do they run the risk of dehydration?
Exactly. So in older patients, there's different meds. So when it's, when you say something like, what's the appropriate medication, it depends on the patient. If you got, if you got Janet Smith and she drinks no water and you give her a diuretic, her blood pressure is going to go down. But if she's 80 years old, she's going to end up in the hospital with dehydration. Yeah. I mean, it just depends. And then, there's funny caveats. Like if you give someone lisinopril, which is a ACE inhibitor, it works off of the way your kidneys work. Again, the kidneys and the heart are very closely related. If you give someone it and they are walking around going, I've got this dry cough, I've got this dry cough, I've got this dry cough, I started this medicine, I feel better, but I can't. It's a side effect. It's a strange side effect of medication. You can get a dry, resilient cough, and it's not hard to fix, but a lot of people just kind of stick with treatment. They don't communicate with their primary care. So I think that's probably the point to get away from with medicines is, sure, the doctor, the provider, whomever can give you whatever med you want, but as a patient, you've got to communicate how you feel. If you're not feeling good, if your blood pressures at home as you're taking them aren't being affected and they're not improving, your headaches aren't improving, things like that, you're not medicated with the correct medicine, but we can't know if we only see you once a year,
Got it. That's interesting stuff.
Yeah.
See, aren't you guys stuck around for this?
Yes, I am.
Okay. How are your headaches?
Did you bring your cuff? Can we test them?
Oh, that would have been a good idea.
would've been
Funny enough, that I spent Saturday and Sunday fighting a migraine.
Really?
I'm wondering if high blood pressure has something with triggering them.
Well, next time I'll bring my blood pressure cuff. We'll let Lee kick you in the shin, and we'll see how high it goes.
Yeah.
Hey, listen, I've got a callus from having kids.
We all should probably get them checked. in here.
Well,
Oh, absolutely.
so then how does how do machines know? Like if you get a blood pressure cuff at home,
yeah.
how do they know if they're not listening?
Well, you can get the electronic one.
Right.
So they work the same way. It's just a pressure gradient. There's a formula within the actual software to say, oh, okay, this is when
So
I
it's
should
best
calculate.
just to go to a doctor.
Well, so the ones at home, some
Or
are
buy
really good.
an Apple Watch.
Yeah.
Doesn't that do it for you?
They don't
Those thing's keeping me
they
alive.
They do rate, not pressure.
Okay.
So they'll do your heart rate.
So what is so how do those two relate
Does the
to
ring? Does that ring do pressure? That new ring they came out with?
I don't think so. I don't know.
So
That'd be
what,
cool though.
Okay, so what about rate and do they correlate with each other? The rate and heart rate and blood pressure.
So they do. There's a lot of different types of cardiac diagnoses that can kind of complicate that question. But for the most part, let's say you're severely dehydrated. Okay, someone puts you on too much diuretic.
Okay.
Your pulse will typically go up. So if you don't have enough volume to get to the rest of your circuit, your heart wants to work harder to get it there. If your fluid overloaded or under stress, it'll kind of do the same thing. So what you have to look at is when the system is under stress, whether it's too little, too much, or you're not well, your heart rate will typically go up, whether that's stress or something physiological. Your blood pressure will correlate, but it takes a little more to kind of get it corrected if it's far off.
Okay, check where I am. No. Okay.
What's your heart rate?
64.
It's beautiful.
That's really good.
Okay. Feel much better.
Somebody just hit your car.
103. No. Okay. All right. But they're going to fluctuate all the time, right?
Oh, yeah, absolutely. Absolutely. Blood pressures go up and down.
A resting rate is good. What, like 70? Is that what they try to shoot for?
60.
Yeah.
60 or so. That's pretty good, actually.
Now it's up to 74. Got me nervous.
But if you have someone who's like say a marathon runner, I mean, I've had people with pulses down to 46, 48, and everyone freaks out. Now,
Show off.
if that's not healthy for that individual, you have to look at it in the situation. But for the most part, you have these guys that are extremely devoted cardio athletes, like people that run marathons, triathlons and stuff. And what happens is the heart gets so conditioned that it works more efficiently. And
When I was
need to beat
biking,
quickly.
mine was 55. I mean, it very rarely changed. I mean,
it's not uncommon.
Okay. Look at us all looking at our watches.
Oh, now it's probably
Now I'm
90.
panicking. It's 74.
I mean, that was 40 years. That was 40 years ago.
All right, 67. Okay. All right, I'm going to stop looking.
Yeah,
all right, so now do you recommend a certain type of blood pressure cuff that people should have at home, or they're all good?
One that works.
Yeah.
No, I mean some of them. No, in all honesty, I can't say a specific brand.
And should you do it every day? Like I mean, should people do that every day?
So I think that's actually a really good point to bring up, Bulldog. Is most people don't know how to take a blood pressure on their own.
I have no idea.
All right, so let's say I do send you home, and I say take your blood pressure, and you stand there, you stand with this gizmo, and you go, well, great. Now he's told me how to do this. What do I do? Right. And then you throw it away, and you never come back. But in reality, what you should do is, obviously at a time where you're not super stressed and you haven't chugged 15 pounds of coffee or decide to have 3 shots or do whatever else, get home at a time you're relaxed, kids aren't driving you nuts, you're not on your phone reading whatever syndicated news you want to try to get into. Both feet flat on the floor,
okay.
Same arm,
okay. Take
your blood pressure and record it. And most of the blood pressure cuffs will also give you a pulse, and I'd say 90% of them nowadays have got, if it's a red light, it's not good.
Okay.
But
that's easy to do.
And I believe, and I don't think I'm speaking out of turn, but I think the Firehouse offers it too.
Absolutely. You can go there at almost any time, and the volunteers will take your blood pressure.
Absolutely.
Yeah.
Yep.
Healthcare. Get one from home. I'm gonna. I'll put that on my agenda.
I will pay for the doctor, you communists.
No. That's not what I'm saying. I'm saying if you have an incident, you can't get somewhere, the Firehouse is a good place.
But see, that's the thing. When when you talk about have an incident, how do you what is the incident?
You feel it.
Yeah.
What do you feel? What's heartburn? What is that? People talk about that. Same thing or different?
Completely different.
Okay, so we're in a different area.
It's so that's esophageal reflux. So that's the acid in your stomach making its way back up your esophagus, causing essentially corrosion of your esophagus.
Okay, totally different.
Making you irritated.
GERD.
You want to be worried about jaw pain and arm pain.
Arm pain.
Yeah. Okay. If we're talking heart attack symptoms,
irritability.
Oh, that's not going to help him.
I'm not going that route.
Now, if you want to talk heart attack symptoms, so heart attack symptoms are going to be, left arm pain, chest discomfort. But it's interesting that you bring up GERD, because one of the major things we learn in school, if you have, it typically happens in middle-aged females. You get females who are like, oh man, I've got reflux today. I've got pain right here. If you say that in my office, you're getting an EKG.
Oh wow!
It's so
don't say it in GW's office.
Well, no, it's really frequent that can be, if it's brand new symptoms, it can be a misguided diagnosis or misguided or missed opportunity to check for some kind of heart disease or
but vice versa too, right? For guys.
Well, and I think
I think I'm having a heart attack, and it just turns out to be a little reflux.
Well, a lot of guys are like, I just started working out.
He's a hypochondriac, so don't go with
it. A lot of guys are like, I just started working out. It's definitely muscle pain. I'm like, why would you only have muscle pain on the left side of your chest?
Mm-hmm. Well, the other thing you touched on is the misconception that it is mostly guys. I mean, women heart attacks. I mean, that's like a great killer of women. I mean,
isn't that the number one? For women too, I think, right?
I don't know about that. But it's up there. And I think women, I mean, women are tough. They kind of power through it and don't think they're getting it, and they sometimes get.
Well, we know they're a lot tougher than we are. I think when we get a common cold, we're
But I think women and heart attacks. I mean, that's they need to take care of it.
Okay.
And Mother's Day should also be a week.
Yeah,
it should be a week long.
Hey, speaking of which, our Facebook question of the day, GW.
All right, what we got?
Brought to you by friends at Touch of Italy. The question is: would you be in favor of an aunts and uncles day?
Oh,
you can be honest.
Yeah, to be honest.
Paternal and maternal side.
Oh my God! Tell us.
Yeah, because some people have uncles who don't exist.
I was going to say, in my case, I'm definitely not having one for him.
I don't think so. And I am an aunt or uncle.
You know what? Your own day.
You're not sure which one?
Okay.
No, I'm just.
Where are we going with this?
Wait, you are
That's a whole other topic.
This is a supportive atmosphere. We're here for you.
And it's okay, though.
This is a safe place.
Nothing wrong with that.
Hey, that is a whole different episode.
Welcome back anytime. We'll go all Oprah on you.
Oh, we can go Oprah. I'll take it. No, I don't think so. I think there's enough Hallmark days, if you will.
Okay, a lot of us feel the same way.
That's my opinion.
Yep.
It's removed all special meaning from stuff.
Dude wanted it because he's a recent.
I just want one day.
You want one day? He needs some recognition.
We do celebrate you.
No, I'm saying
in August. Remember when he started wearing underwear?
Yeah, 17th.
Yeah.
I'm going. I gotta go. Bye.
Really?
Please run away.
Yeah.
We kept him way later.
Well, I gotta tell you, see, but look how interesting it was because he wanted to leave right away. GW Smith is here from AGH and you're over at 10th Street.
10th Street,
right?
Absolutely. Primary care over at Townsend Medical Center.
And I know a lot of people who use you and love you, man. You got a lot of fans out there.
That's good.
Yep.
I like that.
GW's my guy.
I love my patients.
A free blood pressure screening with every visit. That must be an appointment.
That's valid.
There you go.
That's valid.
Yeah. It's not
That's
a lie.
100%. No, it's not.
Yeah,
That is.
you always get one of those.
Yeah,
Huh?
you always get one.
That's the first thing you do.
Yep. It's a package deal with the temperature and
Okay.
everything else.
All right. So what and is this? Are we in hypertension, high blood pressure month this month? Because it is. Doesn't everything have it? It has a month.
Yeah.
Could have been aunt and uncle month.
Yeah.
No.
Well, thank God for that.
How'd you get yours?
Most
So
aunt
now
uncles
the
have
other thing we were talking about is white coat hypertension, and we started talking at the beginning, and that's a real thing.
Yeah,
Okay.
absolutely.
People get nervous.
Yeah, so I mean, everyone has anxiety, everyone has nerves, right?
Okay.
So some people specifically will come into the doctors, and no matter what we do, they have high blood pressure. Specifically, I had a patient last week, obviously no names, nothing like that, but blood pressure is like 180s, 170s. The diastolic number, however, though, was like, it was moderate. It was 90 to 85. It wasn't horrible. And I was like, this is the second time you've been in here. You swear you don't have high blood pressure. But this says you have high blood pressure.
Okay.
The guy looks at me and I go, so did you take, your blood pressures at home? And he was like, no. And I was like, so here's the deal is I can't be with you every day. So the way that we look at white coat syndrome is in normal situations, at work, at home, whatever, you sit down and take your blood pressure and it's normal. And then you come to the doctors. And every time you come to the doctors, whether it's me, whether it's Dr. Bell, whether it's Dr. Beck, whether it's whomever you're seeing, hopefully within our network,
okay,
and your blood pressure goes up, it correlates to a symptom of white coat. But you have to, as a patient, go home and get the data to make sure you're safe. Because if you have high blood pressure and you have high blood pressure, high blood pressure, that's what all your records say, guess what I'm going to think?
You got high blood pressure.
You got high blood pressure. Mm-hmm. But if you come in and go, hey, here's my journal, and hopefully you're being honest because all I'm trying to do is protect you from yourself.
Yep.
These are all 120 over whatever. I'll be like, okay, cool. We'll keep checking it as long as everything's good. You don't have any headaches, vision changes, chest pressure, tightness. Do an EKG once a year, make sure everything's cool, and we'll get you out of here.
All right, sounds good, but you got to do it. You got to put the work in too.
Yep.
Mm-hmm. Hey, I just want to let you know, GW. I just got a message from someone who says I am GW's best patient.
Oh, geez.
That's Billy Bruce. He's not afraid to say it. And that doesn't violate HIPAA because he said it himself.
I love Billy.
Yep, he loves you too. He said He said the only reason he's here is because of you. So
yeah, thanks a lot.
Yeah.
Next time he breaks a computer, I'm sending him back down there.
With injuries?
Yeah.
All right. Go there and see him, 10th Street over there at AGH. GW Smith, thank you for the lesson on high blood pressure. Again, I never knew what the numbers meant. You learn something every day, and you do know if you have the symptoms or even if you don't have the symptoms,
right,
go
absolutely.
get it tested.
Mm-hmm. Yeah.
All right.
It's worth it.
I'm buying it. I'm going to tell my wife, come on in. Take your clothes off. Why? Because he said you're supposed to every time.
Pre-screening.
I didn't hear that part.
Biggest risk factors before I go, if I can.
Yeah, absolutely.
All right, so too much salt, too much alcohol, too much weight gain, not enough physical activity, and then the number one, smoking and genetics.
Okay. How do I get rid of the genetics?
Yeah.
That's the one.
Is there a procedure for that?
I quit smoking years ago.
Or is that like
genetics I can't get rid of.
It's like a Michael Jackson thing where you just can't escape it.
Yeah.
That was good.
When you say too much salt, how much is too much salt? Like when you say drinking, what is where do you put these things? Because
all right, so the majority of everything in our diets has salt, right?
Okay.
If you're adding salt to every one of your meals,
yes,
and you're not getting enough water and you're not having the appropriate balance to be able to wash those things out, you're going to end up with high sodium. So the way that your body works, it's kind of like those diuretics I was talking about, right?
Yep.
So water follows salt. So if you're constantly creating a circuit that's going to be depleted because you have so much salt in it that you're decreasing the amount of water in your system, you're going to have a high pump factor. So
okay.
I mean, you're going to increase some high blood pressure. The stresses associated with smoking, since we're running down the list, it commonly causes things like coronary artery disease, blockages, and as you increase a blockage, if you take a hose and you decrease the diameter, pressure goes up.
Right.
Weight gain, more stress at the vessels in your body because there's more to support. That'll do it. And then without doing proper cardiovascular fitness, keeping the heart moving the way it should, that'll certainly contribute.
How much cardiovascular do you recommend?
For you personally?
No, yeah, for me personally. No,
20 to 30 minutes a day of fairly vigorous activity. But again, if you're someone who's been diagnosed with hypertension, talk to your doctor first.
Okay.
Because you don't want to go out and be like, my blood pressure's been high for the past 3 years. I'm going to go take on CrossFit.
Okay.
And then you're going to have a hospital visit.
Okay. So even walking for 20, 30 minutes?
Walking 20, 30 minutes, yeah, absolutely.
Okay.
Absolutely.
Do you know anybody who would walk me?
Would walk you?
Yeah, I need some motivation.
I venture to say maybe Billy Bruce.
Okay. No, I walk him.
Okay.
I have to let him out to go pee-pee.
I'm not letting the two of those guys.
Slow down now, partner.
All right, good information, GW. Thanks for coming in. I really appreciate it. It's great to see you.
Thanks, Bulldog.
And we appreciate it.